Elizabeth.
Maryland Congressman Andy Harris helped block a plan that would bring some of the immigrants to a housing facility near his district in Maryland. He joins us now live for more on the discussion. Congressman, I want to start with this. There's a lot of folks all over the country, especially in sort of the northern states, that don't really understand how the immigration issue affects them. You have all these kids down on the border near Mexico. But as you're pointed out here, this is really becoming a nationwide problem as the administration figures out where to try and move these people to.
Absolutely. If they haven't figured it out yet, those people in northern states ought to pay attention, because in Maryland, they tried to move these illegal alien children here, and they're still trying to.
Congressman Harris, I've read some of the things that you've had to say about this, and amongst them is you talk about the health issues that could and the risk that these children could bring in terms of bringing that into the communities.
That's right. We just don't know what, because HHS is not being clear with us about what these health issues are, what the incidence of the diseases are in these children. In their rush to move them out to these facilities, we understand that in one of the border areas there actually wasn't a disease check before they got moved out of the border areas. These are questions that just have to be answered before we know the safety of the HHS plans. We just don't know what those plans are.
So let's talk about the monetary costs. President Obama, he submitted a request, $4.3 billion, a supplemental spending request to help handle this crisis at the border. That was 2 weeks ago. The ICE, let's see, was it Homeland Security Secretary Jay Johnson saying that if lawmakers don't act soon, there could be trouble. What needs to be done?
What needs to be done is the humanitarian thing, which is actually to hold these hearings as soon as possible that these children are entitled to, and then repatriate them back to their mothers and fathers and families back in Central America, to discourage what's going to be now 10,000 children a month coming to the United States.
And how much does it cost to fly these children to states like Maryland and then turn around and fly them back before we send them home?
It just seems to make no sense, but the Department of Health and Human Services has asked for over $1.5 billion with no plan on how this is all going to end.
All right, Congressman Harris, thanks for joining us from Maryland. We appreciate it and your insights here as this immigration topic continues to capture the headlines. At least it did up until we had these two other major stories. But really, it's continuing all throughout this summer as you're dealing with the humanitarian issue of all of these people here.
It is a humanitarian crisis. It's also a budget crisis, and we need to continue to talk about it. And I'm glad that we had him on today.
And a security crisis as well. All right.
Well, still ahead.